Hi, my name is Julia, and today I'm going to be showing you guys how to do an IM injection. So the first thing I would do is assess the patient's medical history and their history of different medications. And then I'm going to check the MAR for my patient and what they need. So my patient is Diana Ramo. She is going to be getting the influenza vaccine at 11:25:20 or on 11:25:20 at 5 p.m. This is going to be administered in the deltoid muscle one time. The dosage is 0.5 milliliters, and this is an intramuscular injection. So the needles already come from the hospital prepared. So all I'm going to do is I'm going to take my needle from the Pyxis, and then I'm going to recap it. Well, I would perform hand hygiene, then take my influenza vaccine syringe from the Pyxis, and then I'm going to recap it using a swooshing motion with one hand. Then I'm going to check the influenza vaccine against the MAR system for my second check to check that that's correct. So then I'm going to take this into the patient's room. I'm going to close my curtain, perform hand hygiene, and then I'm going to put on a pair of clean gloves. Hi, my name is Julia. I'm a student nurse from Oakland University, and today I'm going to be inserting your influenza vaccine intramuscularly. Can you just state your name for me? Okay, and then your date of birth. Okay, great. So I'm going to check that against your wristband. Do you have any allergies? Okay. So there's a few different sites that I can use for intramuscular injections. One is below the acromion process. So you take 3 fingers, put them below the acromion process, and then that deltoid muscle is where you'd administer the injection. The second place is the ventral gluteal area. So you'll take your hand, put it the base of it at the greater trochanter and the top of the iliac crest, with your thumb pointing towards the patient's groin, and that area between your fingers is going to be where you'll administer the injection. The last site that you would use is the vastus lateralis. So you'll put your hand right here below the greater trochanter, and then just above the knee, and that area there is where you'd administer the injection. So now that we've talked about all that, I am going to uncap the needle but avoid contaminating it, and put the gauze between my 3rd and 4th fingers. So I'm just going to administer the IM injection in your deltoid. I'm going to put it in quickly at a 90-degree angle, insert the medication, pull it out, and then pull gauze over it to make sure that the blood doesn't bleed. Is that okay? That the site doesn't bleed. Is that okay? Okay, great. So I'm cleaning it off with an alcohol swab. Then I'm going to press down on the injection site. Actually, no, I'm going to pinch up on the muscle, and then I'm going to administer at a 90-degree angle. I'm going to insert the so first I'm going to aspirate a little bit. So I'm going to pull back to make sure that no blood comes in. So you do that just to make sure it's not in a blood vessel. So then there's none, so then I would administer the medication and then pull it out, hold gauze over it, and then dispose of the syringe in a sharps container. I'll hold that there for a little bit, but I don't want to massage it. And then afterwards, I'm going to remove my gloves. I'm going to put the patient back into a comfortable position for them. I'm going to ask them, do you have any patient complaints about the medication? No? Okay. And then one other thing I forgot. So my first medication check would have been my 3rd medication check would have been at their bedside, but I would have given them all the 6 patient rights. So I would have said, Diana Ramo, medication is going to be the influenza vaccine, 0.5 milliliters. I would have said this is a intramuscular injection. That this was done at 5 p.m. And then I would have said the last thing, which was that I would document it. So I'm documenting it now, but I just wanted to point out that I would have done that 3rd check there at the bedside. So documentation, say Diana Ramo, 5 p.m. at 11:25:20, 0.5 milliliters of the influenza vaccine, no patient complaints, J Kettlehutt OUSN. And then I would just come back and check the patient for adverse reactions in 30 to 60 minutes. Thank you.